We start with an abdominal radiograph of a skeletally mature patient. What immediately stands out to me are the multiple gas-filled, distended loops of bowel located centrally in the abdomen, which is consistent with small bowel obstruction. Minimal gas is visible in the colon, which further supports this diagnosis. The bones appear unremarkable, and I don't see any features that would suggest perforation, such as free gas under the diaphragm. However, if there is clinical concern for perforation, I would definitely recommend an erect chest radiograph to rule it out. Next, moving on to the CT images, we can clearly see multiple fluid-filled loops of small bowel, which correlate with the findings from the plain radiograph. But what really catches my eye is this target sign visible in the left side of the abdomen, just above the pelvic brim. This appearance is characteristic of intussusception, where one segment of the intestine telescopes into an adjacent segment, causing obstruction. In this case, we are dealing with an ilio-ileal intussusception, as evidenced by the location in the small bowel. Now, in adults, intussusception is typically associated with a lead point, which is often a benign or malignant tumor. Here, the patient's high-grade small bowel obstruction strongly suggests that surgical intervention will be necessary, even though we can't clearly identify a specific lesion on these images. The patient's clinical history and further intraoperative findings will likely guide us toward the underlying cause, whether it's an inflammatory polyp, a benign lesion like a Meckel's diverticulum, or, less commonly, a malignant tumor. In an exam setting, you might be asked about the imaging features of intussusception and how to differentiate it from other causes of small bowel obstruction. Key features to highlight include the target sign on axial images and the pseudokidney sign on longitudinal views. You should also be prepared to discuss the importance of identifying a lead point in adults, as intussusception without a lead point is much rarer in this population compared to children. Next steps would involve urgent surgical consultation, as operative intervention is often required in adult intussusception, especially when there's high-grade obstruction. If you found this explanation helpful, make sure to subscribe to Radiology Made Easy. We've got plenty more cases to work through together, and I'll be with you for every step. See you in the next case.